breast augmentation surgery is one of the most popular and most commonly performed cosmetic surgical procedures in the country. And there's a lot of subtle complexities in breast augmentation to give you a great result. I think a misconception is that if you have silicone implants placed that you have to get them traded out every 10 years. That's not the case with the new FDA-approved silicone gel implants that are used in the United States. I think another misconception is that size is everything. It just matters how many cc's is your implant, and people don't take into account, well, what profile is the implant? There's 3 different types of profiles, 5 different types of profiles, and that has to be properly suited to the patient and their desired outcome. And then finally, there's the issue of where do you place the implant? Above the muscle, behind the muscle. Behind the muscle tends to last longer and look a little bit more natural. But above the muscle is a lot easier to do, which a lot of surgeons just do for a short-term result. And one of the most important issues for the good-looking breast augmentation is whether or not you actually need a breast lift or not. And that a lot of times does not get talked about. And sadly, a lot of people will they'll have a breast augmentation surgery, and they'll end up with what we call a Snoopy nose deformity, where their breast is still sagging over the implant, and that needs to be fixed with a formal breast lift. Now, fortunately, I can actually combine and perform the breast augmentation and breast lift at the same time, which is a little more challenging, but results in a very beautiful result for the patient in a single staged operation. So these are just a little bullet points about what makes breast augmentation surgery actually a little more challenging than people realize, but what goes into making a really beautiful result. So thank you very much.